This program is made possible by the support of Delta Dental, Quick Trip, Wisconsin Hospital Association.
However, since the start of the pandemic, a record 5.4 million people have lost their health insurance. By the end of 2020, that number could be as high as 10 million. How does this impact our state? And how does this impact the care that patients seek out? So let's get started. Our first guest tonight is a guy who not only plays a mean game of euchre, but he's Wisconsin's governor. I'd like to introduce Governor Tony Evers. Governor, it's great to have you with us.
Am I now unmuted? Perfect. Well, thanks so much, Jodi, for your good work and for that great kickoff. This is obviously a really important topic, and I just want to thank you so much, and it's a pleasure to be here. You know, it was about 3 years ago that Senator John McCain cast his famous thumbs down vote on repealing the Affordable Care Act. Unfortunately, here we are 3 years later, and in the middle of a global pandemic, no less. And Republicans are still trying to repeal health care for millions of Americans, including 2.4 million Wisconsinites who, like me, have pre-existing conditions. So I was proud to be able to deliver on our promise to remove Wisconsin from that lawsuit that will gut the Affordable Care Act if it is successful. But what this pandemic has underscored is that we need to ensure that everyone has access to quality, affordable health care. You know, from passing a budget that made record investments in healthcare, and Representative Emerson did a great job in helping us get through this, through that last budget, especially around healthcare. So we made some good investments there. We have a task force that is addressing soaring costs and prescription drug prices. And I'll say, just as an aside, they met just this last week, and I had a real testy group of conversations with pharmacy companies across the country. Big surprise, right? And we also have a WisCover.com website that helps connect folks with experts to find healthcare coverage. So I'm proud of what we've done to make sure that healthcare has been a priority in Wisconsin. But the bottom line is that COVID-19 has uncovered, exposed, made worse major shortcoming in our country's and our state's healthcare system, from lack of access and affordability to systemic inequity. We've seen minimal plans and efforts from the federal administration, the Trump administration, to combat this virus. And that means a lot of this response has fallen to us at the state and local level to procure and provide that special equipment that's necessary to stay safe, to set up testing sites, and to do whatever we can to keep people in Wisconsin safe. And that is, I just have to, and this isn't a political comment, but I'll tell you, if the federal government would have right from the get-go said, we're going to take care of equipment, or we're going to take care of testing, they could have, and it would have put us in a much better place than we are today, but they did not. And so, you know, frankly, we send National Guard all across the state of Wisconsin to do the majority of the testing in our state. You know, thank God for them, right? They're our friends and neighbors all across the state, but they are doing the majority of the testing in our state. So we know it could have been done differently, and we continue to struggle around that. But equally important is we know this pandemic has hit communities of color particularly hard. We know that COVID-19 has stripped an estimated 5.4 million Americans of their health insurance between February and May. And as the federal administration have downplayed the pandemic, I thought it was changing, but it still sounds the same to me from the federal level. And frankly, here in Wisconsin, they've challenged our efforts to try to keep people safe. We know this is only making it harder for our economy to recover. Unfortunately, the Trump administration and Republicans have spent more time villainizing science and safety than working to contain this virus. I had a chance to see 5 minutes of the national news tonight, and I saw the president taking on his good friend, he says, Dr. Fauci. I don't know how you can spend your time belittling and demeaning a person and then continue to say he's your friend and he's a leader in this area. It can't be weirder. I don't know how else to put it. So we have a long road ahead of us, recovering from this virus and its impacts. And frankly, this pandemic has shown we need to continue to start with healthcare, continue to prioritize healthcare. I was just last evening on the late news in the Madison station there, the head of United Way in Wisconsin was talking about the Alice report from 2018. And for those of you who are familiar with this, and I bet most of you are, we have a relatively large segment of our population is below the poverty level, and then another big hunk, that's not a statistical term, but a big hunk of people in this state that just barely get by. And their paycheck is just enough to maybe do rent and food and shelter and education and all those things that are the basics. And that's a large part of our population. And in 2018, a large part of that big group had not very much health care health insurance, health protection, and we're the ones that were struggling. So you think about it in the context of today, that was 2018 data. So that group has expanded dramatically. So we have a long road ahead of us as recovering from this virus and its impacts. And frankly, this pandemic is really helping us focus on healthcare. So we need to expand Medicaid, in case anybody forgot about that mantra that we talked about for a couple of years, since even before I was governor of the state of Wisconsin. That would provide healthcare coverage to tens of thousands of Wisconsinites and bring hundreds of millions of new federal funding to our state. And that hundreds of millions of dollars comes from us. We're not taking it from California. That's our tax money going to Washington, D.C. That could be used for all sorts of programs that would help, moms and babies programs for African Americans and all sorts of other programs that really would help us move this state forward. So we have to invest in measures that address these disparities and outcomes, and that money that we would get as a result of expanding Medicaid, which frankly has been used and adopted in the reddest states of the country, and that 70 to 80% of the people of Wisconsin support. And I think, frankly, we would get that up to 90% if it was something called other than Medicaid expansion. And so we need to invest in the measures to address healthcare disparities. And one of the simplest ways is to take that Medicaid expansion. So in addition, that's simple. And we also need people to wear masks during this pandemic. We need to have folks stop taking the issues that are really basic to staying safe and healthy during this pandemic: masks, social distancing, Don't go into a small space with a whole bunch of other people at the same time, because chances are you're going to not come out of that room in a good way. And also just make sure the best hygiene that you can do. It is not rocket science, and it's not political football. So with that, I want to thank you for joining tonight and everything you're doing to keep people safe and expand access to healthcare in Wisconsin, and most importantly, keeping the conversation alive. I think this is so critical. If we're right in the middle of an election and we have all sorts of people, I mean, I can't imagine there would be a candidate for the Assembly or the Senate this time around that at some point in time, both the Democratic and Republican candidates should be answering the question, would you vote yes to expand Medicaid in the state of Wisconsin? It's a simple question. Any candidate, I don't care if you're a D or an R, should be able to answer that question. And if it's no, then you know who to vote for, the person that said yes. So this is really good work you're doing. I'm really jazzed about the opportunities we have in November. I'm very, not pessimistic, but I'm very concerned about where we are as a state in this pandemic. But we will do everything we can to make sure that we continue to have the great testing that we have in the state and the contact tracing, and do whatever we can to mitigate this disease. But right now, having every adult and kid that can wear a mask should be wearing a mask. So thank you so much for your time. Thank you, Jodi, for doing such a great job.
Thank you so much, Governor, for joining us tonight. And I'd just like to thank you and your team for the work that you are doing. It is so helpful to be in a legislative office and know that we can contact you or anyone in your team and get answers. And that communication between those branches of government really just does impact our constituents in a positive way. So thank you guys for the work that your whole team is doing. With that, I would like to now turn and introduce our other guests tonight. I'll just kind of introduce their names, and then as I call you guys out, if you can tell us a little bit about yourself, what area of the state you're in, what type of medical setting that you work in, that would be great. So let's start out with Dr. Julia Kyle. Dr. Kyle, can you tell us a little bit about yourself and where you work?
I'm Dr. Julia Kyle. I have been a physician in Eau Claire for 21 years. I am a proud Badger, went through Wisconsin public schools from kindergarten all the way through medical school, so I'm a huge advocate of our state. And I am an internal medicine and pediatric physician. I am in the process of opening my own medical practice called Confluence Healthcare, a small private practice in Eau Claire, after working for Marshfield Clinic for 18 and a half years. And in the last 2 years, working with the Chippewa Valley Free Clinic, working for inpatient addiction medicine through L.E. Phillips in Chippewa Falls, and teaching with a residency program here in Eau Claire. So lots of different hats that I've been wearing lately. And so know a lot about how these policies affect the people here on the ground. And I'm coming to you live from the Chippewa Valley Free Clinic. So.
Thanks, Dr. Kyle. And you guys do some great work at the Chippewa Valley Free Clinic. So on behalf of Eau Claire and the Chippewa Valley, thank you guys for the work that you do with that. With that, I will turn it over to Dr. Lori Whitis, because she also has a hand in the clinic as well. Dr. Whitis, are you there?
Yes, I'm the medical director at the Chippewa Valley Free Clinic, and we see primarily the ALICE population. We see patients between 100 and 200% of federal poverty level. So our patients are the ones who can't afford to sit at home for 7 days while they wait for a COVID test result to come back, and unfortunately are more likely to maybe go back to work before they should. But what we're seeing a lot of currently is that outside of COVID, people's chronic medical needs are still ongoing. And so we do provide medications. We provide acute care, trying to keep people from waiting too long to seek treatment and ending up in the emergency room. We see people that are not able to afford medication. And so by the time they come in to see us, maybe they've been off their medications for a couple of weeks, or they've been taking half as much insulin as they're supposed to be because they're trying to make it last longer. So there are a lot of challenges facing that group. And we would be happy to give the 100 to 130% to Badger Care. We unfortunately sometimes get into a spot where we have a patient, there's only so much we can do for a patient, and we have to wait for them to get bad enough that they lose hours at work or lose their job, and then they qualify for Badger Care. And it doesn't seem like that should be the way a person should go about getting health care.
That's the exact opposite of the goal that we all want, to keep people healthy. So yeah, we definitely have some problems in our system, don't we? Next, let's turn to Dr. Jeff Hebner. Dr. Hebner, are you there?
Hi, good evening, everybody. Yeah, my name is Jeff Hebner. I'm also born and raised a proud Badger. I grew up in the Milwaukee area and went to medical school there at the Medical College of Wisconsin. I currently work here in Madison, Wisconsin. I'm a family doctor that takes care of the full range of age patients from birth to 100 plus. I happen to have a panel of patients that leans geriatric, but take care of that full range of patients. I also have a medical director role in the UW Health System with population health. And I'm speaking on my own behalf tonight, but also I'm very active with a national organization called Doctors for America. And we're a national organization of physicians that are working for the total health of our patients and communities over and putting patients over politics, patients over our profits and our pocketbooks, and really working towards high quality, affordable healthcare for everyone.
Thank you. Thank you very much for that work. And our last guest tonight is Angelina Wyatt. Angelina, are you there?
Yes, I am. My name is Angelina. I currently work as a registered nurse for Milwaukee County Mental Health Services. I work in our crisis psychiatric department. There we deal with high-risk individuals who may not be compliant with the social distancing, who may be acutely psychotic. I also work with our local union, Wisconsin Federation for Nurses and Teaching Professionals, and we advocate for patients over profits, as well as accessible health care for disproportionate people.
That's amazing work that you guys are all doing, and I'm so grateful that you're all here tonight. So we're just going to kind of start out this roundtable discussion, and I'll try and kind of call on each of you as we bring up questions. But first, I'd like to just kind of get a feel so that our audience knows, before COVID hit, so like about a year ago, let's say, 6 months ago, can you kind of set the stage for us with what you were seeing in your different areas, your different practices? What were some of the problems that, from your perspective, Wisconsin was facing when it came to having access to healthcare? And Angelina, we'll just start out with you again. We'll maybe work our way back. So.
Well, I work born and raised in Milwaukee, Wisconsin, county of Milwaukee, who have had a longstanding history with the lack of access to quality health care. We are dealing with chronic health issues such as high blood pressure, diabetes, a lot of comorbidities. So when the pandemic hit, it just kind of added to that. We're already kind of in a hole and pretty much dug ourselves into a greater hole. Thousands and millions of people have lost their jobs, which in turn they're losing health care. So being able to get to providers to test is really hard for this particular population, as well as the accessibility of testing has been initially very limited in the Milwaukee area. Initially we had a hotspot area where we had a lot of positive cases. Due to the lack of testing or accessibility of testing. I think that has improved a little bit. However, we are still facing challenges with making sure that everybody that needs testing can go get testing and that is free. And also with healthcare workers that our employers are providing free testing for individuals, worker who's exposed or may have contact with somebody who has been COVID positive. So being in this city of Milwaukee and the county of Milwaukee, it definitely has stressed already system where we were dealing with a lot of issues. So I'm hoping that this COVID kind of sets the stage for how can we improve our care and our outcomes in the city of Milwaukee.
I think that's a great point to bring up too, because I don't think that the pandemic is, it's highlighting problems we already had in the system. And I'm hopeful, this is when I'm wearing my glasses half full hat, I guess, that those of us who are seeing these problems are maybe going to call more attention to it. And maybe we can fix some of these systemic issues that we had because COVID is calling more attention to it. So, Dr. Hebner, what were you seeing in the Madison area? Can you kind of paint the picture for us with your practice and what you're seeing in Madison?
Yeah, sure. I mean, so many problems that we're, I know, talking about and that we will talk about. We could go on and on, unfortunately, but I mean, just to highlight a couple of them, I think one of the biggest ones is definitely affordability issues. I mean, a lot of patients who don't have insurance clearly cannot afford to come to the doctor, and they worry about what a medical problem will do to them, and that leads to them putting off care, not being able to afford their medications, making tough decisions about, should I pay for my asthma inhaler or my insulin, or should I, be able to get groceries for the family and make sure that I can pay the rent this month. So those conversations came up. They still come up even more so now. People are really dealing with and have been dealing with for a long time that high cost of care that we have in this country. The Affordable Care Act made a lot of things better. Clearly, millions of Americans and many Wisconsinites got health coverage that they didn't have. And that's also helped the health systems who don't have to spend as much of their money on charity care. But there's still significant problems because people have very high deductibles. And that's the main thing. The amount of cost sharing that a patient has affects then the conversations that they have with me about, can I afford this treatment or this test? And truthfully, doctors are usually not very well trained in how to have those conversations, but unfortunately, we don't even have the information. It's a big issue that's sort of unique to America, that patients and their healthcare professionals can't easily figure out how much something's going to cost. I happened to just go to the doctor recently myself for something, and I got something zapped off my leg with liquid nitrogen. I think a lot of people maybe have had that experience. And that more than doubled my bill. I just opened it today, and I thought I had paid my deductible. I had $400 or $450 more to pay. And luckily, I have the income to be able to do that. But I know a lot of my patients do not have the ability to easily pay a bill like that when it comes up, especially when it's unexpected.
And, coming from my own perspective, I've had a chronic illness for 20 years, have had to start a recent treatment, and am so thankful for the insurance that I have right now because it's the best policy we've ever had. Actually just had like a $25 copay on it. For us, it's never been a question. We'll figure out some way, whether it's taking out a loan to pay off these bills or whatever, because health needs to come first. But I know not everybody has those family members to borrow from or the resources to access. And it's heartbreaking to me that in one of the best countries in the world, that our friends and neighbors have to make that choice of, do I put food on my table or do I get my medication filled? Whether it's for my child or for somebody who's elderly. It's people all across the spectrum that are seeing that. And this is what we have coming into COVID, and we'll dig into this a little bit later. Where has it gone from here? So, Dr. Whitis, I'd like to turn to you now. So, can you talk about what you're seeing in the Chippewa Valley and at the Free Clinic a little bit with where we were at before COVID hit?
Well, as I mentioned, we see patients under 200% of federal poverty level, but we do not see anyone that has any kind of government assistance, so Badger Care or Medicare. 60 to 65% of our patients are employed. Many of them have more than one job, but they're doing things like fast food, retail, appliance delivery. Interestingly, many of them are essential workers, quote unquote, now. They might not have been called that 10 months ago. So if they have an employer-based insurance, they generally can't afford it, or as Dr. Hebner mentioned, deductible, $6,000, $8,000 deductible, which is essentially basically not having any insurance. So we do see people all the time that are having to make those decisions between filling their prescription or paying their utility bill, or our situation is nice because we can take some of that pressure off them by providing their medications, their glucose test strips, their, doing their blood work. But we do see people all the time who have put off going to the doctor. And sometimes, we can do amazing things. We had a young woman in whom we diagnosed a malignant melanoma, and she was in her late 20s. She said, well, I wouldn't have gone in for this. I wouldn't have been able to pay a doctor's bill to see this. Well, we quite likely added years to her life for, diagnosing that early on. But it is amazing in a country like ours that people have to make those kind of decisions.
And so at a free clinic, you guys are helping people who have insurance, but because their deductibles, their copays are so large compared to what their incomes are, they're just not able to afford the care a lot of times.
Most of our patients
gets to that catastrophic level. So
yeah, most of our patients are uninsured, but we do have, I think, 10 to 12% that are underinsured. Okay. We also have about 22% of our patients are Spanish speaking, monolingual Spanish speaking. Many of them are farm workers or restaurant workers. And, that brings us a whole other level of complexity to trying to access healthcare.
Yes. Well, thank you for that. Dr. Kyle, can you speak to a little bit of what you're seeing in your practice as well?
There we go. If I go back to that point in time, one of the things that I want to point out is the addiction community. And I was seeing a lot of people from all over the state because L.E. Phillips is one of the few inpatient detox centers in the entire state who were struggling with addiction and struggling to get help. A lot of people who desperately wanted treatment for their addiction and couldn't get the help that they needed. And what was so heartbreaking for me covering the inpatient is that we couldn't get them ongoing help. As everybody knows, treating an addiction for a couple of days and getting somebody through withdrawal doesn't help things in the long run. So many of these patients had Badger care, but couldn't get any help past there. Again, many of them either unemployed because of their addiction, at risk of losing their children because of addiction. And Representative Emerson, as you well know, one of our big budget issues in the Chippewa Valley is the amount that we're spending on foster care. And so what was frustrating to me as a physician is that I could send them 5 places to get a good quality knee replacement, but I couldn't help these patients with an intense, awful, life-threatening medical condition because that care just wasn't available anywhere else, especially for somebody with Badger care. So that was the addiction hat that I was wearing at that time. The other thing is I was in the middle of trying to start my own independent private practice, and never in a million years did I think I wouldn't be able to get hand sanitizer, soap, gloves, and things like that. And so it really changed my life significantly in trying to do that. And then also, I think Lori touched on very well what we're seeing with the free clinic population. What I want to add to that is actually working at the free clinic as a physician is one of the most gratifying things that I do, because we just look at the patient and what does the patient need. And we have a dispensary. So when I see a patient with diabetes that's untreated, I know they're leaving with insulin, as opposed to seeing them in my own clinic where they may not be able to get that. I know that I can refer them to a nurse educator and they'll actually go because they can afford it. I can refer them to a program we have called Healthier You, where they can work on lifestyle issues. And we've had patients, lose 50 pounds or more working with our Healthier You program, which is something, I love to refer people when I was in private practice, but I couldn't. There just weren't those resources and they weren't affordable. So in many ways, what we were seeing at the free clinic is that I could provide better care to my patients than I had been able to provide them in private practice.
Well, thank you for the work that you are doing through there. And I know that there's been a lot of lives touched through that clinic. So I want to skip ahead a little bit here now and talking about the coronavirus health crisis. We've heard, the Affordable Healthcare Act seems to be kind of a political football. And, at this time where we need to have as many people covered under various healthcare pieces to contain the spread and, treat people before it gets too bad. We're seeing President Trump asking the Supreme Court again to strike down the ACA. And if that is successful, as many as 23 million more Americans can lose their health insurance. And so I just kind of want to go around our table here too and talk about what does that decision say to you guys from how President Trump is prioritizing public health, and how would that impact your populations? Julia, let's start with you.
Well, first of all, personally, I am insured because of the Affordable Care Act. I left my job, and once I could no longer get COBRA, the only place I could get health insurance that was affordable was on the marketplace. So doing what I'm doing, I never would have been able to do prior to the Affordable Care Act. So I would be uninsured, would be the first thing. Thankfully, I would probably be able to find insurance someplace, but for many people, they wouldn't be able to. What it says to me is just a lack of understanding of how much the lack of healthcare drives poverty in our society and how much it has trickle-down effect. I think of if we had affordable universal healthcare in this country, how many people would strike out and start a small business? How many people would not have the worries? How many people would not have the housing worries that we have? Housing is a huge issue in our country right now. There's just so many things that because of our lack of affordable healthcare, even with the Affordable Care Act, but that would be magnified and worsened without the Affordable Care Act. It shows a complete lack of understanding of how much health affects the lives of every American.
Yeah, I think that's a great piece too. And you put in there about how people could expand businesses or start new projects. And I think especially in Eau Claire, where we have such a wonderful creative economy. And incidentally, Lori and I know each other from our days of being band parents together. So that's what kind of connected those dots for me as well. Lori, do you want to talk about that at all? Like, what's your thought on President Trump's public health priority? And, if ACA went away, how does that impact the populations that you deal with?
Well, it feels 100% irresponsible to get rid of ACA with absolutely no plan to replace it. But there's a huge disconnect, I think, an understanding of reality. For instance, even early on, President Trump was kind of pushing this. Well, we're going to give free COVID testing, and we'll encourage the insurance companies to waive your copay. Well, that doesn't mean anything if you don't have any insurance. So, one of my patients ends up in the ICU. We're not waiving copays there. I mean, they will never recover from that financially. I mean, even if they recover physically. And I think that that's so outside the realm of where a lot of the people in this administration live that it doesn't even make sense to them to think of it that way.
Right. Yeah. I mean, we can't all be experts on every arena, but we can surround ourselves with experts and listen to them. I think
it would be nice if you listened to them and believed them once you have deemed them experts.
Yes. Dr. Hebner, can you speak a little bit about your thoughts on what would happen if the ACA went away, and how would that impact the populations that you deal with?
Right. Yeah, I mean, it would be devastating. I think so much progress has been made for patients who have healthcare through the marketplace. In other states where Medicaid has been expanded, they're able to come in and see me or see other health professionals without worry that they're going to be bankrupted by it, and they're going to be able to afford the care that they need and the tests that they need, the treatments that they need. So I mean, if that was dismantled without adequate replacement, it doesn't make sense to me. It's showing that there's not a priority of the health of the American people. There's not a priority of public health, which the pandemic has certainly shown. And I mean, clearly people have delayed diagnoses or just unmet care that leads to people dying sooner. I think there's no way around it. Like, we just have to acknowledge that if people don't have health insurance, they're much more likely to die. And that's not right in America.
And so are you saying with your patients that if they are uninsured or very underinsured, are they waiting till longer along in their disease process before they come in and get help?
Yeah, I have a couple of patients recently that have dealt with delayed diagnoses because of how things have played out during the pandemic. They had insurance, but it was an example of delayed diagnoses for, in both cases, cancer, because people weren't coming in. So people aren't coming in right now because of the pandemic. It's the same thing when there's not a pandemic. If people don't have insurance, there's that pandemic too of people not coming in because they don't have insurance. And I would also say, besides getting diagnosed and treated for symptoms, it's also important to talk about all the upstream things that people don't get then, whether it's vaccinations or their cancer screenings and other things that are going to keep them well.
Yeah. Angelina, can you talk about what you're seeing in Milwaukee? I mean, you guys have some struggles down there already from talking to colleagues of mine. But how do your populations that you deal with in your practice, how would this impact them if the ACA went away? And what does that say about the Trump administration's attitudes towards public health from your perspective?
I pretty much agree with what Lori said. It shows irresponsibility of the president, almost to the point to where it's incompetent to even think about how important healthcare is to our economy as a whole. If we don't have health insurance with the ACA, we're talking about delaying care, unmet needs, financial burdens, and all these things eventually affect your mental health. So then you're dealing with mental health crises, and that can, the outcomes are unpredictable. So it can be an increase in violence, suicide rates. So we definitely need affordable health care. And in Wisconsin, we actually need to expand the Medicaid so those low-income individuals can have access to care. We need to be screening for preventable diseases on a regular basis, annual exams. These are things that already Milwaukee County the system has failed us on. So to take away the ACA is just going to further make those issues more evident, and we're going to be seeing more and more issues with these morbidities and deaths that we have already been seeing, and it probably can increase. Most definitely, I'm sure it will increase. So we definitely need health care.
Thank you for that. Another piece I want to turn to now is, despite receiving briefings and warnings as early as December, President Trump really downplayed the threat and refused to act on it early. How does the bungled response from the Trump administration impact the health and safety of workers and families and communities that you're seeing? Dr. Hebner, let's start with you on this question.
Yeah, thanks. I think health professionals, and I'll be interested to hear my colleagues' reactions on this, because back in March, this was a new disease still. It was only, it had been a few months. It's still a very young disease that we're learning about, but we know so much more now about how to tamp down this virus, how to prevent the spread. The governor talked about the things earlier that are not rocket science to do. And I know health professionals, a lot of my colleagues are disheartened right now because we're just not following the science. So, think about the hottest topic that I've seen in the news the last week or so, which is whether to open schools again. And I have 2 school-age kids. We're going through this, trying to figure it out. And if we as a country had done what other countries have done to tamp down the virus, flatten the curve, and keep it down, other countries have caseloads daily that are less than individual states right now in the U.S. If we had done all that, people across the political spectrum agree that opening schools for our kids is the best thing for them and families and our economy for so many reasons. But the community spread right now is so high, especially down south and in other parts of the country, but has been at concerning levels here too, where schools and school districts don't necessarily have the resources to feel that they can open safely. So to me, that's one of the biggest things. And clearly, there's a lot of people who have to go to work, the essential workers beyond the healthcare professionals that we were talking about earlier, that are continuing to be exposed because we have not had the leadership to make sure we do what's necessary to keep people safe.
Lori, do you want to follow up on that and talk about what you're seeing from your perspective?
I mean, people would be tempted to say, oh, sure, in hindsight, it's easy to say what should have been done. But I mean, honestly, in mid-March, I felt like we were looking at a tsunami coming at us and nobody was taking it seriously at the federal level. I mean, and I'm just a private practice, just family practice doc. I don't have all this international experience and people advising me, but it was pretty clear this was going to be bad. And the minimizing, when the president, I guess, felt he was being reassuring to people by minimizing it, was not helpful at all. It was not helpful. And I think a federal coordination of supplies, for instance, would have gone a long way towards alleviating the PPE problems. We had, states bidding against each other for PPE and for ventilators. And I mean, there's just there's no excuse for that, I don't think. And that the leadership has been completely lacking at the federal level.
Julia, can you comment about what you're seeing too from this? How does this impact your practice?
I have a unique perspective as somebody who's trying to start a new medical practice in the middle of all of this. And I always knew that I would probably have to work in a pandemic. We're kind of overdue for one. And that's something that as a physician, I always kind of anticipated. Never in a million years did I think that in the United States of America, I would be wearing surgical masks, the same surgical mask for days. Normally we wear it with one patient, one time, one patient. And that's something I never in a million years thought that I would be doing, much less the N95s. I can't even order them. And, to have to go through a state medical society or some sort of nonprofit organization, and even those aren't medical grade, they aren't the ones that are fitted. A lot of really low quality products that we're getting at hospitals that aren't even, sealing on our faces. I never thought that in the United States of America, as a physician, that my life would be put at risk by a lack of a federal response. Every person in this country is valuable and important, and we need to protect every person in this country. And the fact that we can't even protect our medical professionals to help treat this is just crazy. The other thing that really scares me as we talk about, we need a vaccine to come out. I do pediatrics as well, so I do many regular routine vaccinations. I can't order needles. I can't order needles and syringes right now because they're being bought up and prospected because people look to see that there's going to be a profit somewhere down the line when a vaccine comes out, or they're being bought up from the federal government. Nobody knows. They're just not available, or is it our supply chain is disrupted because they were made in China? I don't know. But never in a million years did I think I couldn't have the supplies to do routine child vaccinations, because everything is being allocated. Half of McKesson's orders are being allocated to the federal government, and we don't know where they're going. So it's crazy. Really, you can't make this stuff up. And I am more than willing as a physician to work in a pandemic, but never in a million years did I think in the richest country in the world that we would be this poorly armed, to use that analogy, that we wouldn't have the tools that we need to fight the war on this illness.
That piece just makes my head swim right now, because as we're thinking of going into back to school time, and this is the time of the year where so many kids get their vaccinations to get to school, to think of a needle shortage to get these kids the public health that they need just during normal times, let alone during a pandemic. Wow. Angelina, any thoughts on this question that we're addressing right now with the bungled response? Or I'm sorry, did we cover you already? I'm starting to lose track of who we've gotten on which questions. I apologize.
Yes, would it pretty much
got it. Okay.
Bungled response.
That Julia just touched on with the protective equipment. We know that there's been calls for the Defense Production Act to be enacted and get some of our factories up and running and producing masks and PPE of various types, ventilators, whatever. And as we're going back to school now, and schools are needing more masks and more PPE to get them up to speed. And just yesterday, I heard this news report about nursing homes getting shipments from FEMA, and they open them up and they're basically garbage bags with like a hole cut in, and those are the gowns that they're supposed to be using. And so let's go to Angelina first, but can you talk about what is your status of PPE? And we'll kind of do this one pretty quickly through this question, but where are you guys at with PPE for your practice right now? Do you feel like you've got enough? Do we have that under control right now, or is that still a big issue?
It is still a big issue. From day one, we were at points where we were being subsidized what we wore. And just maybe a month ago, we were down to 20 N95 masks, and our administration was not handing out any masks to any frontline employees, which was very disheartening, because we are the ones that are doing the initial assessments to determine whether somebody may be potentially exposed to COVID. So at this point, we take our N95s and we disinfect them however way you choose to, whether you're using Lysol spray, or some people put theirs in the oven for a little bit of time, but we store them and we keep them. And because we had a back supply ourselves, even though they're deemed contaminated, we had to go into our reserve pretty much and reuse our N95 masks. And this is still to this day. Even there's no consistency in what type of mask you get initially, where you have to perform like a fit test to determine what size mask you use. So now we're getting the masks from various vendors, which of course they're going to all fit you a little different. A lot of those are not medical grade. They may be surgical masks or what have you not. A lot of things we never even seen before. But because that's all we have, you either wear it or you don't wear it. And you are at risk every day. We're at risk for potentially exposing ourselves to the coronavirus. And it's sad, like you say, we have this Defense Production Act that's not been enforced in this country, where we should have adequate supplies. If I can't go to work in a healthcare environment to protect myself, I'm definitely not going to send my kids to school and expect for the state to protect them, or for these private institutions to protect them, if we can't even depend on the federal government to protect us. So it's very sad that healthcare, you look at the statistics where healthcare workers don't die because they were not adequately supplied with PPE, and it's very disheartening. And I hope that in the future it does change, because it looks like we're going to be dealing with this for a long time.
Yeah, it's sad that you can't keep yourself safe first and foremost, and protect the people that you're supposed to be serving. Jeff, how are you guys doing with PPE in Madison and your practice?
We're doing okay. I mean, I definitely related to Dr. Kyle talking about the fact that, we're all having to reuse equipment for longer periods of time, that the science seems to indicate is safe, but, it makes you wonder. And I think we're doing a good job. I'm fortunate to work in a clinical setting where it has not been an issue to this time, but I know hearing Angelina's story and so many colleagues, both in Wisconsin and around the country, that a lot of my colleagues are not in the same boat and they have had worries, and especially for doctors and nurses who are actively taking care of patients with potential COVID. That's just unacceptable. I mean, the Defense Production Act should have been mobilized right away. It still could be, and it should be, because, I mean, we're all very fearful of what's going to happen this cold and flu season, which is now going to be cold, flu, and COVID.
Lori, what do you see in Eau Claire with PPE? And I know at one point I was talking to a hospital administrator and they said, I think it was back in April, that they had like 7 swabs for doing the testing for one of the tests for COVID in Eau Claire. So all kinds of issues that we're seeing, but where are we at right now with that, you think?
Right. Testing supplies are in short supply in Eau Claire, and we don't actually do testing at our clinic. And we're fortunate enough that all of our nurses and providers are volunteers. And so I think our providers are pretty much bringing their own, it just says Dr. Kyle's got her safety glasses on. I mean, they're pretty much bringing their own PPE. It took us about 3 months to get some gowns. But that was that, right now we're not seeing acutely sick people with COVID. And we may be seeing obviously people that are pre-symptomatic or asymptomatic. So we have the surgical masks and the cloth masks and that kind of thing. But our particular clinic, that is not a huge issue for us right now.
Julia, what about in your other practice that you have besides the clinic?
Yeah, I still have gotten no sanitizing wipes through my medical supplier, and ended up paying $18 for one canister that we could get through Staples. So we've gone through about 5 vendors trying to find all different things, still trying to get some cover gowns. We did get some that are very different than anything I've ever used. Just the interesting comment about the garbage bags with a hole through them. I'm on a nationwide listserv, and it's interesting kind of some of the really creative things people have come up with to get child-sized masks. I have my retired RN making them, and another patient today who offered to make them because I haven't been able to order any child-sized masks. It's just sad, I think is the best way to describe it. It's just sad that we can't get these products to protect ourselves and our patients.
Well, I really thank you guys for the work that you're doing. We've got just a couple minutes, and so I kind of want to just go around and, get final thoughts from all of you. If we can maybe keep it to like about a minute each. What do you need us to know? What do you need the public to know? What are your final thoughts on how we can fight this together and what we can do about this? Lori, let's start with you.
Well, I guess I would just kind of like to end a little bit upbeat in the sense that I don't think I've ever been more proud to be a doctor. I think the way that the collegiality in the medical community, the cohesiveness, the communication as we're fighting something we've never seen before and having to communicate, and mistakes are being made, but people are, reporting that to each other and trying to do as good a job as we can. I'm really, free continuing education courses and all kinds of things that the scientific community, I think, has really pulled together. The other thing you see in the community, for instance, we talked about the cloth masks a little bit, and we had a group of women in Eau Claire called Mask Bees, and they had 1,700 Facebook followers just in Eau Claire, and they made just shy of 20,000 cloth masks that they donated to all kinds of agencies. I mean, childcare and foster care, and of course, the clinics and the hospitals and nursing homes, assisted living, and at our community table, which are at the food banks and that kind of thing. And seeing that kind of, I mean, you just have to look for that kind of positive things that are going on in the community, and both in the medical community as well as the general community.
Jeff, final thoughts from you?
Yeah, I mean, there's a lot of positive stories about how people are coming together, I think, in communities to help each other out through challenges that they might be having with COVID or social isolation or losing a job. So that's all been super inspiring, and as well as the healthcare community coming together. I think there's renewed attention, and hopefully it's going to be sustained now for all of us lifelong around addressing the disparities and inequalities in our healthcare system and in health outcomes. And I think everybody can work together to address those things, both in their daily lives and also reaching out to and demanding from our political leaders that they speak up for health, that they follow the medical science, and they pass policies that are going to cover everyone and make sure we have a robust public health system so this never happens again.
I think that's a great point. Julia, final thoughts from you tonight?
Yeah, basically that healthcare is a human right, and we get what we pay for in the system the way we built it. And we built a system that is based on capitalism and profit in healthcare, and it is very poorly equipped to provide care to everyone of every socioeconomic status, but in particular the uninsured and those who are essential workers in the time of a pandemic.
I think that's a great point. Angelina, can you give us your final thoughts on this discussion tonight and what you want to leave us with?
Just for everyone to continue to abide by the safety guidelines, whether you feel like you're symptomatic or asymptomatic, just adhere to the social distancing, wear your mask, and for healthcare workers and everyone else, continue to fight. I mean, it is patients over profit. That's how it should be. And we should fight to change the system for a better future.
I think that's a great point to end it on. So I just want to thank all of you guys for being my guests tonight on this conversation. Special thanks to Governor Evers for making time out of his busy schedule to join us and listen in and sharing his insights. And real big thank you to Protect Our Care Wisconsin and Opportunity Wisconsin for making this event possible. For all of you guys who are tuning in right now live or watching this later, don't forget to follow along with future conversations with Opportunity Wisconsin's social media channels. And if you have a story to share, whether it's about healthcare or other issues, please visit opportunitywisconsin.org and you can learn how to get involved. Thank you guys so much for spending time with us tonight. Thank you to all my guests for the hard work that they are doing and making a difference in our communities. Stay safe out there, everyone, and take care. See you later.
Thanks, Jodi. Thanks, everyone. Stay safe.
Thanks.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.